Hello everyone. Before viewing this video, please subscribe my channel. Today's topic is Autism Spectrum Disorder. So what is Autism Spectrum Disorder? Autism Spectrum Disorder is a condition that affects how a person communicates, socializes, thinks, behaves. It is called a spectrum because people with autism can have very different strengths and challenges. Some might need a lot of help in daily life, while others very independent. Common signs of autism: difficulty with social interaction, example, not making eye contact, trouble understanding social cues, repetitive behaviors like repeating words or movements, strong interest in specific topics, sensitivity to sounds, lights, or textures, differences in communication, speaking late, using few words, or speaking in unique ways. What causes autism? We don't know exactly, but it likely involves genetics, runs in families, brain development, possibly some environmental factors during pregnancy. Autism is not caused by vaccines, bad partnering, or diet. Can people with autism thrive? Absolutely. Many people with autism go to school and work, have relationships, use their unique way of thinking to do amazing things. Support, understanding, and acceptance make a big difference. When talking about the approach to autism spectrum disorder, it's important to know there is no single cure, but there are effective ways to support and help individuals with autism thrive. Here is a simplified breakdown of approach to autism. First one, early identification and diagnosis, observation of behaviors regarding language delays, social difficulties, repetitive actions, developmental screening and regular health visits, formal diagnosis by a specialist like a pediatric neurologist, psychiatrist, and psychologist. Why it matters? Early diagnosis means early support which can improve long-term outcomes. Individualized treatment plans. Since autism varies from person to person, treatment plans must be personalized. Common components include behavioral therapy. Here, applied behavioral analysis helps teach skills and reduce problem behaviors. Other approaches are speech and language therapy, helps with communication skills; occupational therapy helps with daily life skills like dressing, eating, handwriting; social skills training helps build relationships and understand social cues. Third, medications if needed, not to treat autism itself, but to manage symptoms like anxiety, hyperactivity, aggression, sleep problems. Fourth, education and school support. Special education plans, classroom accommodations, focus on strengths as well as difficulty. Fifth one, family and community support. Parent training and counseling, support groups, access to community services and respite care. Sixth, regular follow-up, ongoing assessment and the child grows, adjustment of therapies and support as needed. In short, The approaches is multiple disciplinary, lifelong and highly personalized. The homeopathic approach to autism spectrum disorder is a complementary and alternative method that some families explore. It focuses on individualized remedies based on child's unique mental and emotional and physical symptoms. Here is a clear simplified summary. What is homeopathic approach? Homeopathy is based on the principles of like cures like and uses highly diluted natural substances to stimulate body healing response. For autism, homeopaths do not treat the diagnosis itself, but persons as a whole. Key features of homeopathic approach to autism. Number one, individualized treatment. Each child with autism is treated differently based on their specific symptoms and personality. Examples of what might be considered speech delay, repetitive behaviors, sensory issues, emotional patterns. Example, anxiety, anger, withdrawal. Second one, holistic assessment. Focus on the mental, emotional, and physical state. Takes into account birth history, vaccination history, family health, and behavioral patterns. Commonly used remedies in homeopathy: carcinosin for children with perfectionism, sensitivity, and early trauma. Beta carbonica for developmental delay, shyness, and learning difficulties. Stramonium for fears, aggression, and violent behaviors. Tarantula hispanica for hyperactivity and sensory seeking behavior. Note: these remedies are chosen after deep case specific evaluation by the professional homeopath. Fourth one, no side effects if properly used. Remedies are very dilute and generally considered safe, but still should be used under supervision of qualified homeopathy doctor. How homeopathy treats autism. First one, individualization. No single remedy is used for all children. A professional homeopathy takes a detailed case history, including emotional and behavioral patterns, physical symptoms like sleep, digestion, and energy, developmental history, triggers or stressors. Second one, remedies chosen based on personality and symptoms. Here are some commonly used remedies in autism cases: carcinosin, Beta carbonica, stramonium, Tarantula hispanica, Calcarea carbonica, Silesia. These are examples, not prescriptions. The wrong remedy or potency may be ineffective or even aggravate symptoms. Goals of homeopathic treatment: improve eye contact, attention span, and speech, reduce repetitive behaviors and meltdowns, balance sensory and sensitiveness, support immune function, and overall vitality. The treatment process: initial consultation, full history, behavioral analysis, remedy selection, one main remedy, sometimes with supportive ones, follow-ups every few weeks to monitor progress and adjust dosage and remedy. Long-term care. Homeopathy is usually gradual process requiring patience. Safety and scientific evidence. Remedies are not toxic and generally safe if used under professional guidance. Recommended approach. Work with a qualified homeopathic practitioner experienced in autism. Use homeopathy alongside with evidence-based therapies. Track progress regularly and involve your child's pediatrician or neurologist for coordinated care.